Hi, good evening. I'm Lonnie Stonich, the Executive Director of FAN. We're a nonprofit that presents programs exploring human development across the lifespan. I'm honored to welcome you to tonight's conversation between Dr. Meredith Elkins and Rebecca Jenkins. Thanks for joining us. FAN's YouTube channel includes an archive of nearly 400 recordings of past events. I invite you to subscribe for updates when new conversations are posted. And now it's my pleasure to introduce tonight's guests. Meredith Elkins is a clinical psychologist and a faculty member at Harvard Medical School. She serves as a co-program director of the McLean Anxiety Mastery Program at McLean Hospital in Massachusetts. Dr. Elkins's clinical and research interests center on helping children build resilience and emotional flexibility while supporting parents in responding to anxiety with clarity, compassion, and appropriate boundaries. Drawing on both evidence-based practice and lived experience as a parent, she works to demystify anxiety and challenge common misconceptions about so-called negative emotions such as fear, sadness, and guilt. Joining her is Rebecca Jenkins, who is the superintendent of Libertyville School District 70 in Libertyville, Illinois, a valued FAN partner school district. A dedicated leader committed to ensuring every student thrives, she leads with a student-centered approach, fostering collaboration among educators, families, and the broader community to support a dynamic and inclusive learning environment. Guided by the principle of learning together, she works closely with administrators and teachers to strengthen classroom practice and support engaging, equitable instruction that prepares students for the future. We are honored and thrilled to be warmly welcoming Meredith Elkins and Rebecca Jenkins to FAN.
Thank you so much for having us both. Meredith, it's so exciting to be here.
I'm absolutely delighted to be here and to be in conversation with you. It's been really nice to get to know you over the past several weeks in anticipation of this. And I'm really looking forward to our conversation. And thank you so much to everyone who's joined us on a chilly Thursday night from wherever you are. I know it's tough to make a structured appointment this late in the evening with all of the things that families are dealing with. So I really hope that everyone who came finds tonight helpful. Thank you for being here.
Absolutely. I think they will. I, as a mom and as a lifelong educator, teacher, administrator, all of the things, I wish I read your book 10, 15 years ago when my daughter was first born and when I stepped into the classroom. I think you're going to be able to give such great information and tidbits tonight because this is a real concern for a lot of people right now. So if you wouldn't mind just starting before we really dive into the questions, would you share what inspired you to write this book about parenting and anxiety?
Absolutely. And as Lonnie shared, I'm both a clinical psychologist who specializes in the research and treatment of anxiety disorders in kids and in parents, but I'm also a mom. And so my experience of studying and treating anxiety just took on a different life once I became a parent. And the book was actually in its early stages when I had an experience as a parent that was really challenging for me, both as a mom and as a psychologist. And oddly enough, it started with Irish step dance. So we live in a part of Massachusetts that's known as the Irish Riviera. If you yell Sully around here, like 40 people turn around. And so, this is how my people dance. And so naturally, my daughter, when she was younger, she was interested in it and we signed her up and she was so excited. But then on the first day of class, she panicked and she refused to go into the studio. Now, I treat anxiety for a living, so you would think that this would be my finest hour. Because as a psychologist, I know that facing fears with support is what helps kids grow. But as a parent with a social media feed, I realized that I had just been flooded with this gentle parenting infused narrative that her discomfort was unsafe. And that if I didn't pull her out of Irish Step immediately, I was writing the origin story of her childhood trauma, or that I was going to be pushing her over the edge into burnout by forcing activities on her, or that I was creating this fundamental attachment injury and our relationship was going to be doomed, or even just that I was dysregulating her nervous system. And I don't really know what that means in that capacity, but it just sounded really bad. So, In that moment where her anxiety increased and mine naturally followed, I realized how vulnerable I was to this narrative that I should be utterly deferential to my child's distress. And I knew at my core that this message wasn't right. And the reason I knew this was because I specialize in providing exposure therapy. And I'm sure we'll talk about it more tonight, but this is the gold standard treatment for anxiety disorders across the lifespan that encourages patients to approach rather than avoid discomfort. And through exposure therapy, I've seen kids who were afraid to sleep alone, who can then go to overnight camp, and, teens who were afraid to drive, go on road trips with their friends, and, parents who were afraid to hold their infant because they were afraid they were going to drop their child, be able to get their parenting bliss back. I'd seen this work in so many families, but when your own child struggles, you really question everything. And so this is where I realized this tension existed, where I feel like so many of today's parents are stuck. I hear about this in my clinic, I hear about this in my carpool line, because the very things that kids need to grow is so often framed by our modern parenting culture as the bad parent move. And this dynamic is creating so much more anxiety for parents who are already stretched paper thin. And, I realized in that moment, of course, my daughter and I would have both felt so much better if I had said, no problem, honey. You don't have to do Irish step. We are going to go home and we'll get ice cream on the way back. But I knew that this would have taught her a lesson that I didn't want her to learn. Because from my work with so many other kids and parents, I know how quickly that lesson it sticks and then it snowballed. And she would have learned that escape feels good, right? Even from an activity that she really wanted to do. And she would have believed the lie that anxiety was telling her in that moment, which was, there was something truly dangerous here. Otherwise, why would mom pack it in and we would flee? But then what happens later when she's in a math class that feels hard and she wants to bail? And I see this patterns every day in the families I treat, these in well-meaning attempts to minimize our kids' distress. Parents are emailing teachers to reshuffle group assignments so their kid doesn't have to work with the mean girl, or they're driving miles out of the way every day to avoid crossing a certain bridge that makes their kiddo really nervous, or they're sitting with their college age kid, reassuring them for hours and hours while their worries just keep buffering, but they don't resolve. And in the moment, I know that these things all feel like the good parent thing to do, but the problem is that these well-intentioned attempts to protect our kids from hard feelings has created the perfect environment for anxiety to thrive. And that's really what I wanted to address in this book. It's meant to be an empowering guide for parents so that they can start reconceptualizing their relationship with anxiety as not something to be feared and avoided, but as a natural, normal part of life that um, that we can all learn to cope with better. And paradoxically, by leaning into it rather than away from it, we take the power from it. So I'm so excited to talk more about these ideas, and to apply them to the parents in the room, to the educators in the room, to the clinicians in the room. Let's dive in.
Well, and it's very interesting, all of those points that you made, even when I was reading the book. Like, a lifelong educator. I'm in a school, I'm in a classroom. And when my daughter turned 5 and went to school, she cried every day when I dropped her off. And I was like, this, and then we want to be perfect parents. I'm like, this can't be my kid. My kid has to go to school. What?
Right, right. This is supposed to be like the place where she's going to shine. It's your home base.
This is going to be great. And so it's those moments where it's about you and my anxiety in that moment and how I look and how I'm perceived.
Yeah.
And these are very interesting things that you go through throughout your entire book. And then her anxiety and how do I help her and support that without over parenting. So I think as people read this book, there's a lot of hope and good information both for parents and for educators because we see those same things in our interactions with kids in schools as well. One of the questions I wanted to ask you was really about like parenting anxiety, and it's been around forever. And I think you led into this a little bit with the over parenting, but can you delve into like what is really different in today's age with parenting and anxiety and how we're responding and where we're seeing that in the world that we're living in?
Yeah. I do think that we're in a different era. Anxiety and parenting, they've both been around forever. And I think it's really important to acknowledge that the anxiety that we feel when our kids are struggling, I mean, that is an adaptive feeling. That that horrible pit in your stomach that you get, when your child is an infant and they cry out in the middle of the night and you like lurch out of sleep. That was adaptive for our early human ancestors. It helped us to keep our kiddos alive, right? And so much, I'm sure we'll kind of come back to this throughout our talk tonight, but so much of the emotion of anxiety is a relic of our deep evolutionary past, operating in circumstances where it's just not as dangerous by and large. And so that primal anxiety, that primal urge that we have to protect our children, it still exists, but the environment around us has changed a lot. And it's not just the environment, it's not just the relative safety of, the modern Western world, but what's different now is the cultural model of parenting that we're operating inside. And what we're really seeing now is what sociologists in particular have termed intensive parenting. So this is the dominant cultural framework that drives the beliefs and expectations around ideal parenting today. And some of it, frankly, is probably protective for anxious kids and for anxious parents, or just any parents. But the challenge that I think we'll keep coming back to is that it can also lead parents inadvertently to respond in a way that encourages overparenting, so over involvement, over protection, and over control from this well-meaning place. So, what is intensive parenting? I think we all sort of know it when we see it, but sociologists who actually study this kind of define intensive parenting in a way that I think is really useful to unpack a bit. So, the first tenet of intensive parenting is the belief that children are precious, that they are precious, that they are fragile, and that they need protecting from the outside world. And that parenting is seen as a moral obligation, requiring near total investment, especially from mothers. Dads, we see you too. And I think by and large, the data to date show that this is still something that is impacting female caregivers, primary female caregivers, even more. Not across the board, but that's kind of still where we're seeing it. And within the intensive parenting model, good parents are expected to parent in a way that is first child-centered, meaning that we follow the child's lead. So the implication of that is that if a child is upset, your job is to neutralize that feeling of upset, right? Or if your child doesn't like something or doesn't want to do something, that the responsive good parent acts, right? The second thing is that intensive parenting is intended to be emotionally absorbing. So your child's suffering is your suffering. Intensive parenting is also labor intensive, it's financially expensive, and it's expert driven, right? And again, I think that some of these things, if they seem obvious, like of course children are precious, right? Or of course we should be emotionally absorbed in our kids' emotional experience. I think the very fact that those things seem self-evident shows how deeply ingrained we are in this culture. And so the underlying promise of intensive parenting is that if we just do enough, if we sacrifice enough, if we research enough, if we intervene enough, if we plan ahead enough, then we can guarantee good outcomes. And researchers have actually talked about the intensification of intensive parenting in the 21st century over and above the intensive parenting that was firmly established in the 90s. So this, no wonder the US Surgeon General identified our culture of parenting as one of the major contributors to declining parental well-being. The problem here is that this is the waters in which we're all swimming, and it's really challenging to break out of this. So what do you do as a parent when you recognize that your child is having an emotional response, is having an anxious response to a situation? Say they're afraid to go into the school building, and your culture is telling you that you're a monster if you kind of set that expectation that this needs to happen, right? And it can really put parents in a bind and really have them second guess themselves. And going back to my initial example around my daughter and her Irish step class, I second guessed myself and my commitment to we have to stick this out, right? So I had to kind of lean into psychological flexibility, which we'll unpack, I think, more this evening, and make a choice that was values based for myself. And so what we did in that moment was we stayed, and she cried. And I got a lot of side eye from the parents who were there. And we watched, and we kept coming back every week, just like I know that you and your daughter, you kept going back to school every week. And it was really hard. And eventually she went in. And since then, she's been just river dancing around my house for years now. But I think that the challenge that modern parents have of just how much harder it is to make that decision when your culture is often demonizing you for that. And so that's just amplifying parents' anxiety right now.
Yeah, my child did end up going to school, so
Yeah.
that's a positive. Um,
But it took some time and it probably was just awful for you, right?
well, and it's interesting, like we're all tired. Like everyone's working hard, kids have a lot on their plate, and it's easy to respond with that avoidance
Sure.
or allowing the escape because they feel better. And then when they feel better, you feel better. But
Absolutely.
the cycle is then that you're just creating that relief in that moment, and we're not building those muscles on how to actually address the anxiety or that the feeling that you have. So I loved when that you continue to share stories throughout your book in examples of how that's in real life and how we can relate to that as parents and educators and guardians. And one of the things you really talk through is exposure therapy. Can you explain that a little bit and give some examples of how we can use that in our day-to-day lives?
Absolutely. So exposure therapy, just to do a little stage setting here, is the gold standard approach to the treatment of anxiety across the lifespan. And what that means is that um, if clinicians are saying, okay, so here is a young person or an adult with an anxiety disorder, like what is the most recommended treatment? What is the psychological treatment that has the most research support? It is cognitive behavioral therapy with an emphasis on exposure work. So it's kind of the go-to, the gold standard. Exposure therapy is based on the understanding that avoidance fuels anxiety. And you alluded to this already, and I'm so glad that you did. When we feel uncomfortable, when we feel anxious, when we feel distressed, it is the most natural thing in the world for us to avoid whatever it is that's making us feel uncomfortable. And in the moment, that works like a dream, right? Avoidance is a wonderfully efficient way of decreasing our distress. But what happens when we avoid? Two things. One, we learn that the only reason that we felt better was because of the avoidance. And two, it impacts our sense of self. So we learn that we are not a person who can handle that situation. So while we feel better in the short term, what happens the next time we encounter that situation or a similar situation is that anxiety or distress is actually likely to go up higher and faster than that first time because it's been reinforced by avoidance. And so you see, what we see is this cycle where short-term attempts to decrease distress are effective in the moment, but can create a longer-term pattern of disability. And exposure turns this on its head. So, through exposure therapy, we are gradually and planfully challenging the patient to engage with, to approach the things, the people, the situations, even the feelings themselves that make them feel uncomfortable. And it's not just because we're sadistic therapists who like torturing our patients, it's because it works. It's because this is effective. And I think if we all think back on our own lives, and everyone kind of has an example of something that, something that was harder for them the more they avoided it, and also something that got easier for them the more they practiced it, right? So these are just kind of fundamental truths in the book. I share how because by virtue of being in graduate school for like a million years and living in Boston and Manhattan and not needing a car, I didn't mean to avoid driving, but I didn't drive regularly for a long time. And whenever I did have to drive, especially because it was somebody else's car, I was really nervous. I was really uncomfortable. And so by the time driving was like back in the repertoire and I was pregnant with my first child, I was like, I am going to crash. I am going to kill myself and my unborn baby. And this avoidance, again, it wasn't even deliberate, but it was just kind of prolonged. And it became something that I had to lean into and like practice driving in Massachusetts traffic until I felt more confident. So I think that we all inherently know this, and it's really hard, right? The clinic that I help lead at McLean Hospital, I speak with parents before their kids come to us and they say, they're my child is really nervous about doing this program, or my young adult is really nervous about doing this program. And I say, and they're like, what do I tell them? And I say, well, first of all, you need to tell them that that makes sense, that they're going to be uncomfortable. And I think, starting off just like here is an important strategy for parents when you're like, what do I do with my kids' anxiety? So often we end up kind of inadvertently invalidating our kids' experience where they're like, this is going to be totally fine. It's going to be easy. You're going to be around a lot of other kids. It's going to be great. I think we do this a lot on like the first day of school, or like going back to school or doing something new. Oh my gosh, you shouldn't be worried. Everyone's going to love you. Your teacher's gonna love you. You're the best kid ever. You're going to make a million friends. And that's so discordant with the kids' experience in the moment. They're like, well, I don't feel like that's the case. So what's wrong with me that I'm feeling anxious and my parent is telling me like it's silly that I'm anxious, right? So we always want to start by being like, where is the truth? Like, what is the kernel of truth there? Why does it make sense that you're uncomfortable in this moment? Of course you're uncomfortable. You're trying a whole new way of addressing anxiety. And it's scary to try new things, right? And then this is when we then add on our confidence, expressed confidence in our kids. Then we want to end with not just like, good luck, Godspeed, but, and I know you can handle it. And I know you can do hard things. So we always recommend when parents are like, what do I say when my kid is distressed? Start with the validation and then add the confidence statement that you can do it. Now, I do want to stress that this isn't going to make your kid happily waltz into therapy or, be like, okay, great, and just walk right into school. But what's called a supportive statement, what this does is this provides both the warmth and the limits that you want to put around your child's anxiety, the validation and the confidence that you have in them. And over time, it becomes a template for how they see themselves as it makes sense that I feel anxious here and I can do hard things. So it's a good go-to strategy for families to have in the moment.
It makes so much sense now that you say it. And I can think of so many times as like a teacher, as a mom, that I've said, "Oh, you're going to be fine. Just get out there and do it. It's going to be great." But or like allowed the child to avoid the situation.
Mm.
So what I hear you really saying is in those moments, it's a much better approach to validate their feelings. It's okay to be nervous. It's okay to feel discomfort. It's okay to have butterflies in your stomach. And you're going to be able to handle it, and I have faith in you. Because one of the things you said with especially the avoidance in your book, which really kind of hit home with me, is we're making the children feel like the world is a scary place and that they can't handle it.
Mm.
So it makes much more sense to approach it in that validate and support versus some of these other strategies that I think we're quick to go to uh, because they kind of feel better.
And I wanted to validate you in the moment of saying, like, of course I say, oh my gosh, it's going to be fine, it's going to be good. I mean, why does it make sense that you would say that? Because you care about your students and you want to impress upon them the most likely positive outcome. And this happens a lot. Again, I work in my very small private practice. I work with a lot of women in the postpartum period or the perinatal period. And I think one of the things that's often so hard for new parents is this sense of everyone just told me that this was just going to be amazing, and that and so I feel like something's wrong. So I think in some ways we're doing kids a bit of a disservice if we aren't acknowledging that there's pain here. And I think um, in in our efforts as the grown-ups to smooth a path for our kids to optimize their emotional development, because now we understand how important emotional development in childhood is. We've started treating negative emotions, and when I mean negative emotions, I mean like negatively valenced emotions like anxiety, fear, sadness, shame, guilt, boredom, as as a signal that something is wrong or something is broken, rather than this is a normal, natural, adaptive emotional experience that exists for a reason, that is giving you information about your environment. And really what I make the distinction in the book, that the feelings themselves are not the problem, and the thoughts that accompany the feelings. So the thoughts of, I'm going to go to school and I'm going to throw up in front of everybody. I talk about one of my patients who came to me after she, a 14-year-old girl, she came to me, she'd lost 10 pounds really rapidly, because she had transitioned to high school. She'd seen a fellow classmate vomit in the hallway. Somebody else filmed it and put it online, and the kid was just brutalized, like just completely bullied. And she was terrified that this would happen to her. So restricted her eating before school and during school. This was not an eating disorder behavior. This was an anxiety-driven behavior. And she also started developing panic attacks whenever she was going to be around school. And so she slowly started shutting down. Anxiety and depression really kicked up. Um, and so in these moments with these kids, there is just this urge for us to say, you're not going to feel anxiety, right? Like, it's going to be fine. You're going to have a good day, and anxiety isn't going to come up for you. But so then when it does, the kids will feel like, oh my gosh, there's something wrong with me, and I need to flee. And so a big part of our work was helping her to realize that her anxiety system was kicking in, and her panic was just actually her body's natural fight or flight response. It feels awful, but it can't hurt you. And when we were actually able to demystify the experience, the physical experience of anxiety and the thoughts that go along with it, these thoughts that she was going to vomit, these thoughts that everybody hated her, these thoughts that she wasn't good enough, really she still had a choice. And the behaviors are really what makes a difference. So if she chooses not to go to school, or if she chooses not to eat breakfast, or if she chooses to, not come out of her room and not respond to her friends and just isolate, like that is where the problem comes. And I think parents are often, they often like balk when I say, anxiety can't hurt you. And they, usually come back at me and they say, what do you mean anxiety can't hurt you? Again, my kids lost 10 pounds, or they haven't been to school for a month, or, they won't leave the house, all of these things. But I really stress that it's not the emotion of anxiety that's the problem. It's the behaviors that we do because of anxiety. So much of the evidence-based approach to the treatment of anxiety is focused on the behaviors. I think so often we assume I will do the hard thing when I feel ready to do the hard thing. And it's really the other way around. Kind of paradoxically, when we start acting as if anxiety isn't driving the bus, then we gain new learning and we learn that this was hard, but I could handle it. And that's actually what starts to decrease the feeling of anxiety. So waiting until you're ready to go into school, to text a friend, to order for yourself in a restaurant, um, you could be waiting forever.
Yeah, so you say like being in the discomfort can help build resilience. And you give so many stories about that. So almost before it's like a problem, how do parents build that in day to day in their lives, in their parenting? Can they do that even before they're seeing more larger pieces of anxiety, or is that not possible? Can you share a little bit about that for us?
Oh, absolutely. And I think that's one of the reasons why understanding the exposure model, understanding the evidence-based approach to anxiety is such a powerful tool for parents. Because you do not, as you were saying, Rebecca, you do not need to have like a full-fledged anxiety disorder to benefit from this model and to share it with your kids. When you understand the link between avoidance and anxiety and you kind of get curious about your own experience, not only can you start encouraging your kids to lean into anxiety, but even before that, I think it's really important for us as parents to start practicing this because we we model behaviors for our kids even if we have like a young adult or a teenager who are like they do not care what I am doing, what I am thinking. Like parents are the first and most enduring barometer for our kids. Like our behavior is how they learn about the world. And so, um, if, for example, if we are sort of operating with the belief that urban centers, that cities are scary and dangerous, and, you're going to get hit by a bus, or somebody's going to take you, or you're going to get lost. All of these things that we as parents would worry about in a city center, and we are modeling that because when we go into Chicago or Boston or New York, we are all over our kids like white on rice, and we are constantly communicating to them with our body language and our words and our actions that this is a dangerous place, they are going to believe that cities are dangerous places and they are going to similar feel the same way. So before we can even start really impacting our kids, we need to look at ourselves and think about what we're modeling. So can we think a little bit about what our values are around parenting, the kind of parents that we want to be, what we want to model for our kids, and then can we act in ways where we're, helping to create a narrative of we do hard things in this family, or you know, success isn't the absence of discomfort, but coping with discomfort. And we can do this in big ways and in small ways. If you're about to give, a presentation at work and you mention it to your kid as you're packing lunch and they're getting ready for school, you're like, I've got this thing for work today. I'm feeling really nervous about it. I actually am noticing the urge that I kind of want to call out sick so that I don't have to do it, but like I know that's not going to be that's not the type of person I want to be, so I'm going to do this. right? You may think that they're totally blowing you off, but with that type of repetition, that becomes ingrained. That becomes their template. Similarly, when you see them acting in ways where they're stretching themselves, you know, they're engaging with something that feels hard, they're doing something more independently than they used to be. This is your moment to positively reinforce that, to be like, wow, you know, you drove all the way, like again for your teenager, right? Like you drove all the way across town, like by yourself in a rainstorm. I know that used to make you feel really uncomfortable. Was that still uncomfortable for you? And how did you deal with it? Again, you're getting the wheels turning and you're emphasizing that the success didn't come from the lack of anxiety, but it came from like doing the hard thing despite the anxiety. And so it's kind of like laying breadcrumbs along the way. So look for opportunities to do that in like low stakes ways. And it then helps you to be able to pull data in the future when a kid is really struggling with something anxiety provoking. And you can say, remember when you were able to do this? What does that show you about your capabilities?
Absolutely. So a couple things. The children are watching, especially the teenage girls, because I don't drive right, I don't eat right, I don't breathe right. So she is very much paying attention.
Full
But
of great commentary, I'm sure.
it's fantastic. My ego has like caught with time. Um, One of the things you mentioned, which I think we do as parents, is there's a problem and our child brings us this problem. And then, like, that's all we focus on. So if there's a issue with another student at school, or, they're having a struggle with their dance teacher, then the minute they come out, we're like, how's your dance teacher? Are they treating you well? And you talk through, like, in the book, giving attention, like where you want to find things, you're going to find things. And then also giving praise in the places where we're not talking about those things. So almost like minimizing, and I say this with great respect, but like focusing on the positive and trying to not always give attention to where that discomfort is. Can you talk through that a little bit?
Yeah, and I'm so glad to get the opportunity to do so because, like so many things in this conversation, this stuff is nuanced, right? It's not memeable. It's not there's not a script for it. There's not a quick fix for it. And so it can be challenging to unpack. So one of the dynamics that clinicians like me often see in the families who come to us is that so much of the parent-child interaction is centered on what's going wrong instead of what's going well. It's not uncommon for families where anxiety is driving the bus for either the kid or the parent to feel like most of their interactions center on anxiety. And it's often like if the kid had a good day, like anxiety wasn't driving the bus, it's almost like a let sleeping dogs lie. Like don't point that out. And so what ends up happening is that we're inadvertently reinforcing with our attention emotional distress. So we're giving negative emotions like celebrity status. When they show up, that's all we're focused on. And one of the things that we know, not just from research with humans, but from all animal research, is that, attention in any form, is so reinforcing. And so if I am a young person and I am having a panic attack and my parents drop everything and they come and they remove the demand of my academic work, right? I'm going to email your sophomore year teacher and let them know that this isn't that you need an extension, and I'm going to sit with you and I'm going to rub your back and we're going to talk through this. Again, there's nothing in a vacuum, there's nothing wrong with these behavior. These are kind caring behaviors of parents who love their children and are trying to minimize their distress. Is there anything more human in the world? The problem is that anxiety hijacks this system because by if this pattern is happening consistently, what ends up happening is that anxiety is sort of being like fed. So I have a panic attack, my demands go away, and I have all of this attention and love and support from from my parents. And so, how do we change that pattern? Well, in treatment, we usually do it a couple different ways. One, we're working with the young person to develop their own repertoire of independent coping strategies for managing anxiety and panic, which involve everything from better understanding what's happening with them in their body when they're having a panic attack, understanding what their thought life is about in those moments and how to help combat some of that, and teaching them, different behavioral strategies so that they're not inadvertently reinforcing their own panic. But then we're also working with the parents to help them see the ways in which their well-intentioned attempts to soothe that anxiety and panic are, may be fueling the very anxiety that they're trying to prevent. And so, how can we help the parents gradually start removing the extent of their attention to the panic and to the anxiety? Now, this does not mean that they say, like, again, good luck and Godspeed, get your skates on, you can handle this. The validation, normalization, empathy, and support is always a key component of this. But perhaps it's saying, when the child has made some strides in their treatment, it's saying, I know that panic feels really hard for you right now. Maybe I'm going to suggest one or two coping strategies. Then I'm going to step out and I'm going to be in the next room. Come get me if I can help you practice any of these strategies, right? We may actually have the parent take some space. Now, this is when the intensive parenting internet comes for me, right? Because you do see a lot of folks saying you should never leave a child or a young adult um, when they're distressed. But the question is, they're like, what is the core fear? What will happen if my child is coping with a hard feeling and I'm not right there? Now, if there's a real safety concern, right? We're afraid that this child will hurt themselves or somebody else. That's a different story. Anxiety is no longer the top problem here. But often what I find when I ask parents this is there's this sense of, I don't know, it just feels insensitive. It feels like the bad parent thing to do. And and good parenting feels bad sometimes. And when parents can better understand the link between anxiety, avoidance, attention, and accommodation, we can start more critically evaluating the parenting narratives that are driving us through well-intentioned ways to be giving anxiety that celebrity status that is just increasing it over time.
So we're doing all the things that you're saying, but you notice that you might need help. You might need support from a professional. How do you, as a parent, identify when your child might need a therapist? And how do you go about finding a good match? That can be scary to make
It
sure.
absolutely
Yeah.
and scary and overwhelming. And I think our language is not helping us because we use the term anxiety in our language to refer to the normal, natural emotion that we all have and the clinical condition of an anxiety disorder. So it can be really hard to determine, when is this normative anxiety, when is this a clinical disorder? And I talk about this in the book and go into it more than we'll be able to tonight. But I think for families to keep in mind three different things. When I'm doing a clinical assessment and trying to determine what disorders are present, if this meets criteria for an anxiety disorder at this moment, I'm looking first and foremost for interference. How much is the anxiety getting in the way of life? How much is it stopping the child or the parent from going to work, going to school, socializing, their relationships, doing the things that they need to do and doing the things that they love to do? If it is significantly interfering, then it's likely that we're at clinical anxiety disorder level. Also, distress. So how it's subjective, right? But how distressed is the patient because of their anxiety? And again, this usually goes hand in hand with interference because the more interference you have, usually the more distressed you are by your symptoms. And then we're also looking at duration. So clinical anxiety lasts. In our diagnostic systems, we usually do not assign an anxiety disorder diagnosis until the interference and distress have been present for weeks to months. There are also several periods of kind of in the normal course of life where we actually expect to see anxiety increase. So around transitions, going back to school, summer break can be really tough for some kids, better for others. If there's a move, a family transition like a divorce or a family illness, even if a kid has been struggling with illness or a parent has had the flu for 3 weeks, they may notice that their anxiety is higher than normal. And so the instinct is to jump in and fix it, like you'd said, but often the best thing to do is not to pathologize it the moment that it comes up, but to normalize it, to validate it. It makes sense that you're feeling like this. You've been going through a lot of transitions. You know, what's something that we can do that can make this easier? Can we eat better, sleep better, exercise better? All of these things help raise the bar for our ability to cope. And then we're just waiting and monitoring. But if the interference and the distress lasts, then we look into finding a therapist. I will also say that anxiety disorders are not a life sentence. I think one of the challenges that we're seeing right now in, in young people and in young adults and even in some, parents is this like over identification with anxiety as like, I am an anxious person, I have anxiety. But it is not like, diabetes. It is not a chronic condition, and actually, it is a really treatable condition. So the challenge is ultimately kind of finding support that is impactful and helpful, and that's where like I've got some like hard truths is that it's just really hard to find care. It is even harder to find evidence-based care. And one of the reasons that I wrote the book is not because I expect parents to be their child's therapist, like God knows we've got enough going on, but because if we can start operating from an exposure framework where we're, validating and normalizing the tough emotions, modeling it, modeling our own experience of challenge and resilience for our kids, and we're, encouraging exposure light work, then forming the foundation of the resilient narrative that kids need to help combat anxiety when it gets bigger. That was the hope.
I'm going to shift gears just a little bit. So, as a school superintendent, there's a lot of conversations around technology.
Yes.
Of technology in the classroom, home access. I'm interested, and I know many of our listeners are interested as well. What are your thoughts on technology and the impact or connection to anxiety, if any, or what do you see? What are your thoughts?
Yeah, it's a big question, right? It's very much the question of our time. And John Haidt has written about this so eloquently in his book, The Anxious Generation. Um, I think generally as a clinician, my sense is that if you are worried about your kid offline, then you should be worried about them online. So, what we are generally seeing with the research is that for kids who are struggling with anxiety and depression, who are vulnerable to these conditions, that often, not always, social media and technology is going to it's an accelerant, right? It's an amplifier. So I think in terms of like, do I have a firm limit on like no screens before this age or no social media before this age? I think I tend to agree with Height's recommendations. I think that while there are certainly detractors there, I think that it seems wise to me, but I do think that every kid is different. And you may have a kid for whom being able to form connection and to help bolster a positive identity is actually improved with connection via social media versus the isolation that may come without it. That being said, for so many of our kids who are struggling, who I see clinically, who are struggling with anxiety, we see it, I do see it as more of an amplifier. So I think it's like a proceed with caution if your kid runs hot is generally my recommendation for families. And
No,
so,
that's a great recommendation. Staying on schools,
yeah,
how can teachers help in the
yeah.
classroom? Um, how can they best support students and families with this conversation?
I think very similarly to how parents can help. So I think if educators can create a culture where discomfort is not seen as unsafe, discomfort is seen as part of the learning process, right? I mean, any good teacher will tell you like discomfort is where the learning happens. And so when student distress increases, resisting that urge that it's just as palpable for parents and educators and clinicians. We want our students to feel better. So the urge is to like nip the distress in the bud, but getting better at practicing tolerating our own distress and being like, yeah, this is a really hard problem set. It makes sense that you're feeling overwhelmed here. What's one thing you can try? I think often educators feel like they have to kind of patch it up in the moment. And so it may lead to offering, instead of encouraging more problem solving, it may lead to the well-meaning desire to kind of give the solution or to mitigate the distress by whatever means possible to give an accommodation. And I would just encourage educators where you can to push kids a little bit, right? It doesn't mean ripping the rug out from underneath them, but can you ask them, what have you tried first? Or, what coping strategy have you used? Or what do you think you would do if I weren't here? And so again, putting the onus a little bit more on the student before jumping in. And again, it's a scaffolding process. We're going to scaffold and support younger kids more than we are older kids. But one of the things that I think Height points out, going back to the social media question, and I do feel really strongly about is we're seeing this decline in childhood independence across the board. In independence in terms of kids' ability to do developmentally appropriate tasks for themselves, also decline in independent mobility. And we're seeing that this is likely tied to the increases in child depression and anxiety that we're seeing because if I, as a young person, feel that I need the adults in my life to do everything for me, not only like my practical day-to-day activities and my academic work, but also to soothe my own emotions, then that just breeds more dependence, which is inherently anxiety provoking. So this goes back to something we were speaking about earlier, like what can parents do now? Start identifying areas where your kid can be more independent. And again, if you've got college-aged kids, if you've got, kids in high school, if you've got kids in middle school, all the way down to the itty bitties, there are things where, kids are more resilient than we think. A 13-year-old can be shown how to make macaroni and cheese, and they can make mac and cheese, but they can also be shown how to make lemon chicken with green beans and potatoes and make that for the family. So give instruction and then challenge your young person to do the thing and set a clear contingency for what's going to happen, that you're not going to come and swoop in and rescue them. And so this is how part of how we build resilience is by, setting a reasonable bar for kids to become more independent. And it just is a natural, like a natural anti-anxiety bedfellow.
Thank you.
Rebecca, great conversation tonight with Meredith. Thank you so much for such thoughtful, careful preparation. I know the two of you also connected in the weeks before this. I really want to thank both of you. There's so many great takeaways for parents, for teachers, for professionals, everybody, grandparents, anyone who is surrounding youth. So thank you so much. So much great stuff here. For those of you who might have joined a little bit late after my introduction, there's been some network outages with Microsoft Outlook. So what we're doing with After Hours is we are going to let anyone can join. It doesn't matter if you're a donor or not. We've been posting the link in chat all night. Anne Marie just posted it again just now. That link will be, you'll be able to join at about 8:03. We're going to open up the Zoom at about 8. After Hours is a 30-minute additional time with both Meredith and Rebecca. I'm going to give you some guardrails, which we will stick to assiduously. Meredith is not going to tell you how to fix your kid and what they do in the morning because they won't put on their shoes. So questions about your specific family, your specific situation, what you specifically should do about an individual in your household, those questions won't be addressed because it would not be professionally appropriate for Meredith to kind of go down that pathway. So we'll want you to keep questions a little bit more general. So I'm going to give you that heads up right now if you think she's going to fix it in a minute. She's not going to fix it in a minute, but there are definitely insights, as you can see from tonight, lots of great stuff. Come join us. If you somehow don't get this link that's been in chat, if you navigate to the fan website and you just click on the link about tonight's program, you'll see right at the top, it says bonus after hours event. Click here is just the join link. You don't have to register, you just join. Everyone will join as the title fan guest and we'll have you rename yourself at After Hours. So it's a little bit different how we're doing tonight, but I'm sure it'll all sort out. Great program tonight. I know I want to talk. I have a couple things. It's only 30 minutes, so we're going to also do kind of quick questions, quick answers. I know that I'm sure some folks, I'm curious as to what your advice might be, Meredith, about what can a parent tell themselves in the moment that will help them tolerate the distress of their child? What can they do to tolerate the distress of their child when they themselves might be running a little hot with their own anxiety? Wondering about, is anxiety contagious within a family? Is anxiety contagious within a friend group? Wondering about, when you're talking about social media, wondering about like the new phenomenon of a lot of teen and young adult influencers talking about mental health and what works. And are you seeing some of that coming out in practices where seems like there's some very sophisticated lingo coming out of a lot of young folks about self-diagnosis of what they have and what impact that may or may not be having. So I'm curious about all these things. I promise not to hog the limelight myself. So anyway, we are going to finish up now. Hope folks can join us for Jenny Wallace next week as well. 2 events on the 29th, a week from today. And we'll hope to see a lot of you at 8:03. We're 1 minute late, so we'll see you in just a minute. Thanks everybody for tonight.
Thanks, Lonnie.
Thank you.